This is BBC World News. I'm Yalda Hakim. Our top stories. President Trump says only he has total power to lift a nationwide US lockdown as he clashes with the media over his handling of the pandemic.
We did a lot. Look. You know you're a fake. You know that. Your whole network, the way you cover it, is fake.
We'll be speaking to one of the reporters who was the target of Mr. Trump's criticism. Also in the programme, the number of deaths from coronavirus in Britain is higher than previously revealed, with claims that elderly people are being airbrushed out of the figures. India extends the world's biggest coronavirus lockdown for another 3 weeks. And the 99-year-old war veteran who's doing his bit to help the UK Health Service. Hello and welcome to BBC News. We begin our coverage today with the United States. The number of confirmed cases of coronavirus in the country is now approaching 600,000, with the epicenter of the outbreak there in New York City. As COVID-19 continues to spread rapidly, the governors of states on the east and west coasts are trying to decide how and when to reopen their economies. President Trump insists he alone can make that decision. Well, meanwhile, here in the UK, official figures say nearly half the deaths registered in London in the week ending April the 3rd were linked to coronavirus. London is a hotspot for the disease. In Europe, France has extended its lockdown for another 4 weeks as Spain and Italy start to ease their restrictions. Meanwhile, India is extending its lockdown until the 3rd of May, with leaders saying it'll be strictly enforced. This comes as the World Health Organization says that the world is yet to reach its peak, with 90% of cases in Europe and America. Well, let's hear what President Trump had to say about the lockdown.
The President of the United States has the authority to do what the President has the authority to do, which is very powerful. The President of the United States calls the shots. If we weren't here for the states, you would have had a problem in this country like you've never seen before. We were here to back them up, and we've more than backed them up. We did a job that nobody ever thought was possible. It's a decision for the President of the United States. Now, with that being said, we're going to work with the states because it's very important.
OK, let's go straight to our Barbara Plett-Usher, who joins us from Washington. Barbara, an incredibly heated press conference there, but one thing that came out of it, he said that he had total authority to reopen states.
Yes, which he doesn't, according to the Constitution. The Constitution does give the federal government power in emergency situations to, have discretion over military spending, to have authority over borders between states and restrict travel and so on. But the power over the economies of the states, that's left up to the states. And they also get the police powers that give them the right and the ability to regulate citizens' lives during things like public health emergencies. So he's wrong about that, and it has been noted by, for instance, Governor Cuomo of New York, who has been quite outspoken counterpoint to President Trump. He said, "We have a constitution, not a king." I think President Trump was quite angry about articles at the weekend that criticized his response to the corona epidemic, saying that he had not taken advice from public health officials early enough to prevent the kind of death and disease that we've seen. But as far as the governors are concerned, as you mentioned, they are taking their own measures. Their answer really is their action. They have banded together on the East Coast and the West Coast. 10 states formed 2 coalitions to share information, scientific and economic information, about how they are together going to slowly reopen their economies. And these states control 38% of the economy in the U.S., so they will have a fair bit of a say in terms of how it reopens.
President Trump also did say there was some positive news. And as you say, Governor Cuomo has said that the worst is over.
He has said that, although he said it cautiously. He said that key indicators like infection rates, hospitalizations, and ICU admissions were down consistently over a number of days. And deaths had not increased, although they were still high. And that is one of the reasons that he and other governors on the East Coast are beginning to look at measures on how to reopen the economy. But having said that, it's very fragile because in New Jersey, which is right next to New York, there has been a spike in infections and there's a drastic shortage of tests. So this is not over yet.
And Barbara, you're saying that he was quite frustrated and annoyed at the press and the way in which they've covered his handling of it. He put this extraordinary video on, which showed, the kind of work that he's done so far.
Yeah, it was quite an extraordinary press conference, Yelda, given that these are often quite extraordinary, these White House briefings. They're supposed to be about the latest on the virus and how to combat it, but often just also give President Trump a sort of microphone to air his grievances and to talk about the kinds of things that are important to him. But in this case, he really went after the press, saying that they had been wrong in their articles at the weekend. And then he put on this sort of campaign-style video in which he had cherry-picked quotes from people who were praising his response. And then he also brought his top infectious disease doctor up, Dr. Fauci, to talk about comments that he had made in some of this weekend coverage and put a different spin on it. So it was all really quite a spectacle.
It really was. Barbara, thanks so much for that update there. And of course, a little later in the programme, we'll be speaking to CBS reporter Paula Reid, who had a very heated exchange with President Trump at that press conference yesterday. So we'll be asking her more questions about that. Now to the rest of the day's news. The European Commission is urging EU countries to coordinate any plans to gradually ease coronavirus-related restrictions. Meanwhile, Spain's death toll from the novel coronavirus has climbed past 18,000. At the same time, the rise in new infections has dropped to its lowest level since the country imposed a nationwide lockdown last month. Well, at its peak at the beginning of April, the daily death toll in Spain was close to 1,000. It's since fallen, with 567 deaths reported on Tuesday. But the Spanish Prime Minister says his country is still far from victory. Well, let's go straight to Guy Hedgecoe now, who joins us from Madrid. Guy, we're slowly starting to see these restrictions ease, but as the Prime Minister said, the country is far from victory.
Yes, that's right. We've seen the return to work of non-essential workers, people in the construction sector or manufacturing and other heavy industries since yesterday. As of today, the whole country has now finished its Easter holiday, so we're seeing this at the impact of that return to work. It has been criticised by some members of the opposition who say it's a risky move, it's even reckless. But Prime Minister Pedro Sanchez has insisted that this decision has been taken, with full caution, and that the remainder of that lockdown, which has been in place for the last 4 weeks or so, is going to remain there, is going to continue at least for another couple of weeks, probably more, and it's going to be very tightly policed. That's his position, but he says that this decision was not taken lightly to lift the restrictions yesterday and today.
Guy, because of course that criticism is because just on Tuesday we're still seeing numbers over 500 in terms of the death toll.
Yes, that's right. I mean, that's 50 more than we saw yesterday. Now, the latest figures that have come out over the last few days, we're told we should be viewing with some caution because it has been a holiday period, and that can distort the figures slightly in terms of how they're reported by local authorities. But, as you mentioned before, we are seeing a big sort of downward curve in terms of the number of daily deaths, which was at 950 just about 10 days ago. So it has been coming down quite steadily, although there are occasional glitches that you see one day to the other. And also the other important figure, the new infections, which is down to a very low percentage in terms of daily new infections. And the government has been underlining that and saying that the measures it has been taking have been working. You can see that in the reduction in the number of new infections.
Guy, thank you so much for that update there from Madrid. Now, the skyrocketing death tolls from EU countries like Italy and Spain have been making headlines for weeks. But now data suggests that at least half of those COVID-19 deaths happens in care homes. That's according to a report which looked at 5 EU countries, and it suggests that the UK may be underestimating the number of deaths in its own care home sector. Well, today, new figures from the Office for National Statistics suggest that it is indeed the case, and the number of deaths is much higher than previously revealed. Richard Galpin reports.
In care homes like this in County Durham, coronavirus is proving particularly deadly. 13 people have died here. Across England and Wales, more than 2,000 care homes have faced outbreaks of the virus. But deaths in these homes are not included in the official figures, and there are allegations the elderly are being forgotten.
Somehow care homes have been left behind in this scramble for more PPE, protective equipment, for the emergency admissions, ventilation, and for the testing as well. So there are a lot more people apparently dying in care homes.
According to figures released today by the Office for National Statistics, or ONS, 217 people died in care homes in the week ending April the 3rd. 33 people also died in hospices and 136 at home. Many more are thought to have died since then. Here at the Wren Hall nursing home in the quiet Nottinghamshire village of Selston, they specialise in patients with dementia. Over the past 2 weeks, 9 people have died from coronavirus. It's devastating for everyone.
We're feeling broken, we're feeling raw, feeling so sorry for the ones that we've lost. These people, yes, they're living in a care home, yes, they've got complex needs, but they have died prematurely, and it's really sad and it's soul destroying.
Charities which support the elderly have written to Health Secretary Matt Hancock saying, "We are appalled by the devastation which coronavirus is causing in the care system, and we've all been inundated with desperate calls from the people we support. So we are demanding a comprehensive care package to support social care through the pandemic."
This isn't just about the numbers. Behind each of those numbers, there's a human life. There's a human being, a life cut short early. And there's a grieving family, their relatives, and their care home staff. So by acknowledging the number of people who are dying from COVID-19 in the community, in hospices and in care homes, means as a nation we can be much better at supporting care homes and supporting families and supporting those who are dying so they can die as well as they can do.
For care homes, as for frontline NHS staff, there are still problems with the supply of protective equipment. And now there are reports the government's missed 3 chances to link up with the European Union in the purchase of a huge order of masks, gowns and gloves worth more than £1 billion. The government says it's got a very effective delivery mechanism and overall has been well prepared for coronavirus. Richard Galpin, BBC News.
Well, don't go anywhere because we've got more on that story coming up. We'll be joined by the BBC Head of Statistics to talk about those latest numbers of deaths in care homes or in people's houses in the UK.
I have the power to lower my blood sugar and A1C.
Because I can still make my own insulin, and Trulicity activates my body to release it, like it's supposed to. Once weekly Trulicity is for type 2 diabetes. It's not insulin. It starts acting from the first dose, and it lowers risk of heart attack, stroke, or death in people with known heart disease or multiple risk factors.
Trulicity isn't for people with type 1 diabetes or diabetic ketoacidosis. Don't take Trulicity if you're allergic to it. You or your family have medullary thyroid cancer or have multiple endocrine neoplasia syndrome type 2. Stop Trulicity and call your doctor right away if you have an allergic reaction, a lump or swelling in your neck, severe stomach pain, changes in vision, or diabetic retinopathy. Serious side effects may include pancreatitis. Taking Trulicity with sulfonylurea or insulin raises low blood sugar risk. Side effects include nausea, diarrhea, vomiting, belly pain, and decreased appetite, which lead to dehydration and may worsen kidney problems.
I have it within me to lower my A1C.
Ask your doctor about Trulicity.
Claims that many older casualties are being airbrushed out of the statistics. This is BBC World News. I'm Yalda Hakim. The latest headlines. Governors of US states are discussing how to reopen their economies after President Trump said only he has the total power to lift a nationwide US lockdown. New figures show the number of deaths from coronavirus in Britain is higher than previously thought, with claims that many older casualties are being airbrushed out of the statistics. Let's get more now on that story. Here to take us through the figures is our head of statistics, Robert Cuff. Robert, these numbers are alarming and disturbing.
Yeah, in the UK, what you'd normally expect to see, if you can see the data, is that we see the number of deaths that happen every week falling. We see a peak in the winter during the flu season, and then they come down, and around now we'd expect to be about 10,000 deaths and going downwards. And what we've seen in the most recent figures out from the Office for National Statistics is that it's 16,000 and rising, so 6,000 above where we'd expect to be at this time of year. That's really striking. That's the biggest figure they've seen since they started publishing these data in 25. It is very large, and it only goes back, these are data that only run up until April the 3rd, so it's probably even worse now.
It's extraordinary because we keep hearing this thing about not trusting numbers coming out of China, not trusting numbers coming out of places like Iran. When we're told here in the UK that the death toll in 24 hours is, say, 1,000, that's not entirely accurate because they're talking about just hospital numbers, aren't they? They're not including these numbers.
Well, they're talking about hospital numbers and the deaths that have been reported to them. So on the first point, deaths in hospitals, when you go back and you look at the statistics from a few weeks ago and you see how many death registrations have mentioned coronavirus or COVID, then that enables you to catch some of the deaths that happen in the community, like in care homes. That actually isn't making that much difference to the picture. It increases the number maybe 10%. But what's making a really big difference is these lags in reporting. Because in the daily figures, you can only report what you've been told. And it takes a while for a death to be registered, for all that information to filter through. And when you include that information, you get these really striking figures that are a bit bigger. So when we come back to the question of trust, it's not necessarily a conspiracy, it's just you do the best with the data you have.
And I suppose it goes back to the whole, question around, we keep overusing this term unprecedented, but we are in unprecedented times.
Absolutely. If you think back for maybe a relevant comparison in the UK, maybe the flu season in the winter of 2014-15, where we did see a big spike of deaths, the number of deaths that are being recorded in the week ending April 3rd is higher than that. And as I said, it's April 3rd. We've had a lot more deaths recorded and reported in the UK since then. So I think we can expect that figure to go up.
And just briefly, what can we learn from this?
Well, from the statistics, it's actually a little bit hard to get a clear message because we put too much weight on the daily figures. I think the key question that's left by these numbers is what's being missed. The excess mortality I mentioned a few minutes ago, the extra 6,000 deaths, 3,500 of those have coronavirus on the death cert, but there's 2,500 that don't. Now, that could be deaths where COVID isn't mentioned. It could be maybe, so it's in the community but doesn't get caught. It could be because of the stresses that the coronavirus is placing on society or on the health service or on people looking for care. Or it could be on the effects of the lockdown. Those are really the big questions that are going to have to be addressed as we try and work our way out of the lockdown. And unfortunately, these data don't quite answer.
Thank you so much for giving us that broad picture of what's going on. Now, as we've been hearing, President Trump has given a fiery press conference in which he criticised the way the media has covered his response to the coronavirus crisis. It included this exchange after Mr. Trump touted his ban on travel from China at the end of January as an example of his administration taking decisive action. Have a listen.
I saved tens of thousands, maybe hundreds of thousands of lives by putting
time that you bought. The argument is that you bought yourself some time. You didn't use it to prepare hospitals. You didn't use it to ramp up testing. Right now,
you're so disgraceful. It's so disgraceful the way you say that.
What did you do with the time that you bought?
Look. You know you're a fake. You know that your whole network, the way you cover it, is fake.
Well, that was Paula Reid, the White House correspondent for CBS News, and Paula joins us now. Paula, good to see you. I mean, that was quite an intense and heated debate there that you had with the president. What was it like being on the receiving end of that?
Well, it's certainly not unusual for the work we do here at the White House. It really doesn't faze me. You don't show up to a press briefing to make friends. You show up there to try to get answers, and that's what we could not get from the president yesterday. And often when he doesn't have an answer to your question or he doesn't like your question, he resorts to attacks, even personal attacks. And this is something that has resonated with his base over the past few years, calling us fake news. But it's unclear right now if that is working. People can see this crisis is not fake. The body count is rising. Many people know someone who has died as a result of coronavirus. And if they don't know anyone who's died, they certainly know someone who has been economically impacted. So it's not clear that these attacks will really have the intended effect.
Paula, I mean, as you say, him berating the media is not something that is different, to what happened last night. But what was it about last night's press conference that felt quite different?
It was different. When it had gone on for just a few minutes, I texted someone. I said, "This is unusual." The president has declared himself a wartime president amid the coronavirus pandemic. So you expect there to be an intensity. He was incredibly intense last night, but he really wasn't being intense about anything of substance. He had no announcement on any of the issues really at the heart of this pandemic. Instead, he was fixated on this New York Times report on the media. After a weekend that saw the U.S. death toll surpass 20,000, you had almost no mention of that. Instead, he had this almost manic intensity for a record-long press conference, really fixating on defending himself and attacking the press. And that, even in the larger context of his pattern of attacking the press, was unusual.
Paula, thanks so much for joining us. That was Paula Reid, White House correspondent there for CBS News. Now, Indian Prime Minister Narendra Modi has announced that the country will stay in lockdown until the 3rd of May to try to prevent the spread of coronavirus. India's entire population of more than 1 billion people has already spent the past 3 weeks indoors as the number of cases continues to rise. The BBC's India correspondent Yogita Lamai reports from Mumbai.
India's coronavirus hotspot. Through drones, police scan the city. We can see if you come out of your homes, they announce. In the alleys of Mumbai's slums, health workers are trying to go to each one-room house, screening people for symptoms. This city has the highest number of COVID cases and deaths in India. But those on the front lines say the reality is far more grim than what statistics show. I spoke to a doctor at a Mumbai state-run hospital. He didn't want to be identified, fearing reprisal from the government.
Yes, we are under testing, under reporting. So the other day, 6 patients with acute respiratory distress syndrome, they were brought in dead. We didn't even test them, even though there was a very high suspicion that they might have had COVID. Now, even the relatives were not tested. One of the reasons why we're not testing deceased patients is there is a global shortage of the number of kits. So you want to use your kits very wisely.
It's not just here in Mumbai. Doctors in different parts of the country have told me that people with underlying conditions are often not enumerated as COVID deaths. The other problem is India's testing rate, among the lowest in the world, which means there's no clear picture yet of how bad it is here. A doctor from southern India described what she's been seeing. She too didn't want to be identified.
From my own eyes, they're not testing people. They're just not testing them. There's so many people who are coming with symptoms. They're going to go out and spread it to other people. We don't know how many people are affected by it. We are not ready for it, and there is no way we can contain it. And I'm really scared personally as a doctor.
India's health ministry didn't respond to the BBC's questions about official COVID numbers. The worst might still be some way off, but already nerves are frayed, resources are falling short. We have to wait hours for patients to be admitted, these paramedics in Delhi told us. For weeks, India has been in lockdown, which is set to go on at least till the end of the month. In many parts of the country, it's being strictly enforced and is believed to have reduced the burden on hospitals to some extent. But experts say without ramping up testing, no nation can hope to beat the virus.
More sick people will keep coming and coming and coming until you have an extensive testing and isolation strategy. Or you can just stay on lockdown for long periods of time. But staying on lockdown for India has massive costs, especially for the poor.
Each day is hard for those left without jobs, money, food or shelter. Aid is reaching some of them, but there are questions about how long it can be sustained. Yogita Lamai, BBC News, Mumbai.
Let's go to Austria now, and that country is reopening thousands of shops as it seeks to ease restrictions brought in to stem the spread of the virus. Garden centres, DIY stores and small shops will trade again as part of a step-by-step plan to restart the economy. However, strict social distancing rules remain in place. And just before we go, something that will lift your spirits. This is Captain Tom Moore, a 99-year-old Second World War veteran who's walking laps of his garden to raise money for the UK Health Service. He started with a modest target of £1,000, that's about $1,200 US, but after his efforts attracted global attention, he's now raised over $2 million, and his words should be an inspiration to us all. Have a listen.
Tomorrow you'll maybe find everything be much better than today, even if today was all right. And my today's all right, and my tomorrow will certainly be all right. And that's the way I think I've always looked at it. Tomorrow will be a good day.
It's Captain Tom Moore. We'll be back in 30 minutes' time.
Hello there. Certainly a chill in the air over the next few days across many parts of North America. We're getting a plunge of cold air coming all the way down towards the southern states, and particularly cold, I think, to the east of the Rockies. Also got an area of cloud that's going to be thickening up, may well eventually bring some snow into the Rockies. And we have this weather system here that's clearing away from the eastern seaboard, but lingering, I think, towards the Panhandle. South of that, a lot of warmth in Florida. You can see that cold air digging down across